So, anyway, Aaron, my son's going to be a guinea pig, and Noah's going to record for me, and we'll post up on YouTube. Okay. So, quick history on who I am. I graduated from Adelaide University. I actually did dentistry first, into physical therapy afterwards, so I did a lot of study. And then I studied a guy by the name of Jeff Maitland, who's a specialist on mobilisation, manipulation and stuff, so I'm Maitland trained. And then I did the 88 Olympics, and then I did the Williams Apollo team, lifting teams. And my first job though was working in a nursing home, okay? And you know, have older people coming in, go to the wards and walk around. And the whole thing for us we had to do is keep them ambulating. And then coming to the US, I've been here since 1990, and I have a little office since 93 in Motherhood. And I noticed that in the United States, we look at census, our population is getting really older, especially in Hawaii here. And you guys are all going into the health industry. And when you go in the health industry, the worst thing you want to do is blow your back out lifting a patient. Because I see so many nurses from all around the hospitals here and nursing home facilities who have had to lift up someone and their back's blown out. And it takes sometimes like 6 months or more because of herniated disc, is very painful. So the thing I want to put to you guys, and hopefully you'll be the people going out in the community and pushing this, is to keep people ambulating. And ambulation is everything. Otherwise, you're going to be one that's going to be lifting and dealing with pressure sores, dealing with wiping their butt and feeding them and rolling them around. Your back's going to go. If you can keep them up walking, quality of life's way better. So you have happy patients, and they'll do anything for you. So what I'm trying to do is I want to give it what I've learnt over many years, a system that is able to figure out where the problem lies. Why, you know, auntie one day comes walking in, but walking while she's coming, then next week you have to wheel her in and she's not able to get up and walk. You go, wow, you were walking last week, what's going on here, right? Not good, is it? And so I've got to do something real quick to figure out, do I need to see a doctor or can I do something? So what I'm looking at here is I put on a board here, a system here, where I go assess nerves, then we'll do some muscle testing, then we'll do some joint testing up here, okay? So I've got my son to volunteer, he'll be setting gigs. I didn't realise on rolls. So Aaron, go sit back here so it's on screen. So if you guys want to come around closer, you're more than welcome, okay? In front here. So you can have a seat here. If you want to come closer around, it's more than welcome. So you have to see what I'm doing here, okay? Okay, yeah, that's great. Come around closer. So at least you can see, okay, so poor Aaron, he was really charging along last week with his walker. And all of a sudden he come in, he can't walk, whatever. I'm not going to figure out why he can't walk. So anyway, so first thing I look at is nerves, okay, just to clear the nerves. And we're going to do reflexes first. Have you guys all done reflexes? Okay, so anyway, this seat's a little bit low, and I need to have him sit up. So Aaron, I want you to sit on the, is this solid? Or I sit on here for a second. Just sit up on here. Okay, so take your slippers off. And I'm going to go slowly through this, but usually this whole procedure takes me about 2 minutes, no more than 3 to 4 minutes to go through the whole thing, okay? So you can assess someone really, really quickly. So when you come along like here, I'll first go and check out the Achilles tendon reflex. And he's got good reflex here like that. Taps. Reflex there. As Achilles tendon. So on my sheet up there, you notice I put down patella tendon, okay? And that's L4. Now we're going to go down to your Achilles. Go like that, tap, see how he jumps? Real easy. Got a nice reflex there, tap here, a few chaps, okay? And that tells me that the Achilles, right, which I have up there, is S1, S2, you can see it up there. And then the patella tendon reflex is L4, okay? So we just cleared that, we know that's working. And then there's another thing you might want to do, it's called Binsky's reflex, where they slide along here. And if they have a problem, their toes are with, then you can look up on YouTube, okay? So we know that the reflexes are working. Now, if some people, though, you tap and they have a very weak reflex, so you know it assess it from upper extremity one. So you know how to test biceps, triceps, yeah? So you can see this one's like great, and this one's like not going, okay, or maybe something's going on with it, you know, L4. Then after that, we jump into sensation, okay? That's your next part of your nerve testing. So go on the outside here, just touch lightly. Can you feel that? Mm-hmm. Okay, look, this is S1 on the outside here, right? On the top of your foot is L5. Can you feel that? Mm-hmm. And then on the inside along here is L4. Can you feel that? Mm-hmm. So he's got good sensation there, and same he can feel S1, L5. Can you feel that? Yep. And then L4. Correct. Mm-hmm. And then on the top of your leg, on the outside is S1 right there. You feel S1 there. You feel S1 there. and on the thigh here is L4, L4. So if he's feeling all that, no numbness, great. But if you've got someone who has might hurt their backs, auntie fell down, and she might have injured her back and the nerves, pinched from a disc or something, you find maybe reflexes down or sensation. That gives you clues, okay? So if sensation's off or sensation's off, make a note to see how it is. Then the next thing is we're going to go through muscle testing, okay? And this is the next section. So you look behind up there, like muscle testing. And I call it resistic static contractions. That's how I was trained, okay? And the best resource for that is Kendall and Kendall. You ever look at that book? You can buy it on Amazon, pretty cheap these days, it's like $300. You can buy it for about $80, $60 and get a muscle testing for the whole body. That's my Bible. I learned that inside out as a student. When I was a poor student, I photocopied the whole book. Okay, so the first one I'm going to go to is I'm going to check, Aaron, just push your foot down to my knee really hard, okay? He's pushing down, testing his gastrocs and soleus, okay? And that's S1, S2. So he's push again, pushing up. And that's the same thing as doing a calf raise, right? But since they are in a wheelchair, they may not be able to get up, well, we can test it like this real quick, okay? So I'm going to do the other leg like this. I'll put my knee down like so. Then in the wheelchair, push, get there, push. And applying good resistance, I feel the muscle working, so soleus is working pretty good in gastrocs. Next thing is, we're going to have him lift his big toe up. Lift your big toe up. Measure strength, lift his big toe up, strength. When it's weak, you just push down with your pinky like that. And you know you've got a problem. If you're pushing down, holding up pretty good, got good strength. If it's weak and you push down like that, got a problem compared to the other side, okay? Okay, this is L5, okay, over here. And then I'll check, I'll lift up your ankle. This is the tibialis anterior toe extensors. Just to check, because you might have drop foot and might drag the foot and go right. Everyone else drop foot is, don't they? So this is a quick assessment like that. Then the next one is push against here. We're testing quads, okay? Quads is primarily L4. Push. You've got good strength. And then push in here, that. So good strength so far. We haven't got any deficiencies, okay? If it's weak, one be really strong, the other one like, oh, I've got a problem. No wonder they can't get up. And then after we do that one, I like then to push the knee up into my hand. And that's checking soleus, which is prime move, which is L, supplied by L2, 3. Okay? I need that to lift the legs up when I'm walking. Okay? And if you wanted to, you can do hamstrings, but not so important. Just pull back like that, hamstring, and hamstring like that. Okay? And that's L5, S1, S2. So all of a sudden we've gone through and checked now the reflexes, we've done the sensation. And if something's deficient, you make a little note of it, and you do the muscle testing. And if the muscle testing is all good. Now if they are weak in a muscle, and you know that the reflexes are good, sensation, it's just a muscle weakness issue, oh, right, I've got YouTube. I can go to YouTube, and at YouTube I can look up resources of what sort of exercises I can do, where they do it in the chair. And you're right there figuring this out without having to go to a doctor, and you can start implementing maybe a simple exercise in the bed straight away. Now something from YouTube or whatever, or be creative. Everybody can think for themselves and make up really creative exercises that they enjoy for that individual, and they'll be doing it straight away, and the next day they come in the next day, rather than sitting for 2 months they see a doctor and atrophying away. That's the biggest problem. If you go 2 months, oh man, they're going to waste away, so you'll never get them back sometimes. So as soon as you find out, you get onto it, okay? Ambulation is #1 key, okay? So we just did those things. Now next thing we're going to do a quick assessment, because maybe the muscles are good, the nerves are good, but might have a sore joint somewhere, okay? So we're going to look at the ankle joint real quick. Usually in most people, they might twist the ankle and they've got a little sore joint in here. So you can do a compression test. You're going to squeeze the malleoli here pretty firmly. You can squeeze as hard as you like, should not be sore at all. So you'll go like so, and you cup it, and you squeeze, you go, have any problems? Nothing, nope. Okay? That's where most of the times have problems, is the ankle, because when you're weight bearing, it's sitting in the mortise like that, okay? So if that's sore, they can't want to put their foot down at all, they want to withdraw it off the ground, withdrawal reflex. Then we check the other one, push here like so, no problems, okay. The other thing that happens with ankles, you might always want to check out, is this ligament over here. This is the anterior talofibular ligament, just rub around here, because 80% of injuries, 90% this is where they get sore to the older ankle. Just check real quickly there, and they're not a problem, okay? Now we're going to check out the knee. The knee, just check out extensions. So if we go like so, apply a little bit of overpressure, because they might have, banged the knee and they've got a little bruise on the cartilage. So you're going to do a compression test. So I'm standing up straight, my knee is locked, right? So I'm bent open, I'm going to be closed here. So here, I just want to apply a little overpressure, and that's not a problem, yeah? Okay. And then the most common injury is the patellofemoral joint. If you may have banged it or you get inflammation, it's called chondromalacia, inflammation on the kneecap. And when you want to go upstairs, you know, this muscle's contracting the quads, it's pushing that there, and it's sore. Oh, I don't want to do that, I don't want you to get out of the chair. And when you bend your knees 90 degrees, you have 7 times your body weight of pressure there. Once you get past 90, you have 11 times your body weight. There's a lot of force there. So if there's a little bruise underneath there, a little bit sore, doesn't take much to stir it up. So what you're going to do, you can hold like this or have them laying down, and you get the knees out straight. Get your hand on with your palm on the patella, and you're going to push down like so and glide up into the patella groove. Push like that, and you can push down like that. And it doesn't take much. You apply a little pressure, go, whoa, that's sore. Back off. Okay? So you're going to test it like that. And then same thing here, but a bit like that. You can do it on the bed as well, and then you push down, so you're gliding it that way, straight into the patella groove, like that, and then go like that, and I'm pushing like that. And that's pretty much clear. You can also check the knee all the way bending, but for walking, you only need about 30 degrees bending. That's how far we bend is naturally walking, okay? But you can get to 90, we're good, okay? Next thing is the hip, okay? If you're sitting like this in the hip, you might check a little bit of flexion, push up, okay, good range like that. Check in internal rotation, he's got plenty, and then you check external rotation, the hip rotates out, it's pretty good like that. And ask for pain and all these things, right? I said, oh, that's sore. Well, what you're doing here is you're stretching out your glutes, stretching out here, so you might have a sore spot in your glutes, okay? So you're testing through your knee range of motion, hip, and then have them stand up if they can. So Aaron, stand up, and then hold on to here with your hands. And you might want to check a little bit of hip extension, so can you slide the hip back? Just brings the leg forward. And just check the alignment and then push like that and see if there's a little hip extension. A lot of people walk down like this, right, because their soles are too tight at the back. And that's pretty much that in a nutshell. One more thing though, if you can get them to lay down, lay your back. I'm going to chuck in one extra thing, okay, that probably won't be relevant, but if you were want to check the joint, one more little test I always chuck in here. It's called quadrant. It's a Maitland technique, and you go across, you push down like this, and you bend across. And when they have arthritis, there's a test for arthritis for the hip joint. And usually arthritis is in the front rim here. So when you push across and do that, and usually you go across a 9 o'clock angle, and 11 there, and 12, and usually that angle up there, oh, it's sore. So they have a bit of arthritis in the hip, okay? And you know, then you want, if it's really sore, a lot of pain, and they complain of hip pain, they have to check in with their doctor, okay? So that's basically it in a nutshell. And I can do this in probably 2 minutes flat. Do you want me to see you do it in 2 minutes flat? Okay, Aaron, sit up. Okay. Okay. So when I was doing my rounds, okay, and I'll go in, it was really nice to have 2 assistants with me too. So I'll come in, auntie's there, they set up, I'll go like this, I go tap, get a reflex going, normal, go across here, tap's going, okay, good, sensation, you feel that, you feel that, you feel that, you feel that, yes, you feel that, yes, you feel that, outside there, knees right there, you feel that, just did that all quick, okay, here, push down hard, push, okay, and then like that, and then push this one down on my knee, push hard, okay, good, pull big toe up, both of them, good, pull ankle up, all that, pull ankle up, good, push out, pull back a little bit, pull up, push up, just cleared all that, okay, ankle test, any problems with that? No. Check the ligaments over here on the outside, press that one, any problems with that? Nothing. Like that. Now, grab this, check over pressure on the knee, not bad, kneecap, check that way, glides up that way, check that way. Other one, over pressure on the knee, good, check glide that way, moving it pretty good, go that way, good, okay, grab hip, pull up to the chest, not bad, rotation, rotation. Okay, oh, one thing I could do is do abduction, I didn't do that earlier. And then bring this one up, like that, pretty good. And that was done. So you've got someone like, and if any of those things are deficient, let's see, you look at the nerves, okay, and you know on that sheet there, maybe I should run, take a photo, film this up real quick. So if you post on YouTube, you'll see what we've got there, because I wrote down all the nerve supply, all the muscles and everything. And there are really good books on that, and that's it. I don't know, I'll get through that. Has anybody got any questions? So it's pretty.
I have a couple questions. So how would you determine on the tightness of the hip versus arthritis?
Okay, the arthritis, you know how I did range of motion and pushing it? You can ask them if they have pain, okay? And usually if there's pain, it could be muscle soreness or it could be a joint. And then you have to do more tests. That's why I threw that last one in there, the quadrant test. Because on the hip quadrant, it's more arthritis, we push on that. It could be painful. If it was just tightness, they'll feel it's just pulling back here. There's a tension. When they complain of pain, because I'm pressing joint surface, because when you do abduction like this and with force, you push on the rim of the acetabulum over here, and your hips push against it, and oh, it's sore right there. Because all the tissue's going off stretch here. Adduction, everything's off stretch, so you're compressing on the rim. And if you're pulling out and they complain it's sore out here, this is on stretch. So you have to assess whether you're doing compression or stretch on the joint. And the example again is with the hip. I'm going this way, I'm stretching the glutes. They complain it's pulling here, but they complain of pain here. There's nothing on stretch here. This is all off stretch. So you're on the joint step. If I'm going out here and they complain it's sore here, but this is not compressing the joint, you know the adductors are tight or sore. And that's how you fit. So then you have to do differential like that, compression, compression and non-compressed states. But I just want to get the ambulation reflexes so clear. Because if you've got this done, you can figure out, oh, the ankle joint's inflamed, then they might have to ice it or do anti-inflammatories or see a doctor. If it's muscle testing weakness, oh, you can do it. You guys can do it straight away. You can get going on that, okay? And if it's sensation, nerves, well, it's a red flag, and if they're really bad, something might have happened, they go see a doctor. But if it's just muscular stuff, you need implants straight away before they get weak. Because the number one thing is weakness. The longer they go, they decondition. The research says you have to exercise 3 times a week for 1 month minimally before you get increase in strength. And that was a Journal of Medicine 1976, so I did a thesis on that. And they published that. And so unfortunately our insurance companies only give us maybe 6 visits for the month and then 2 for the following month. So there's no way of us to actually, as PTs, getting stronger anymore. We rely on the people being in the field to figure this out and doing it. So that's where we have to go with this now, because we don't have the luxury of visits anymore in the industry to see people 3 times a week.
Well, with some, they only physical therapists only see them for 10 minutes.
Yeah, and the PT, yeah.
It's all about empowerment, it's all about individual.
Yeah, so we won't go into politics too much, but it's changed so much, and the money is getting shorter, and so the nurses, the physician aides, all those nurses aides all have to know this type of stuff to get going, because at the end of the day, if you don't get this going, who's going to hurt? The physician's aides, the nurses are out blowing out backs, and half our staff's out on work comp or injured. They have to find a new profession. So we have to get this implemented into our medical system.
Tina had a question.
Oh yeah. What do the L by ankle dorsiflexion? What does the L4 and L5 mean?
Oh, that's the nerves from here. So if you look at your lumbar spine, L5's here, L4, that's the nerve roots coming out.
Oh, so L stands for lumbar.
Yeah, lumbar side here. Yeah.
Okay.
So yeah, this is L, and then S is sacral. That's from sacral L down here. So if you look into nerve supplies for different muscles, and that you'll see all what it is. And like, see if you ever get a chance, get that book by Kendall and Kendall, the muscle testing, or even if you just go into YouTube, just Google autonomic nervous system of that, or tell levels in there. It's really a great way to start doing it. Okay, thanks, Noel.
All right.